Unit 10, test questions 5, 85. A client with a peptic ulcer is scheduled for a vagotomy. The client asks the nurse about the purpose of this procedure. The nurse tells the client that the procedure 1. Decreases food absorption in the stomach. 2. Heals the gastric mucosa. 3. Heart stress reaction. 4. Reduces the stimulus to acid secretion. The correct answer is 4. Reduces the stimulus to acid secretion. 86. A nurse is preparing to care for a client with esophageal varices who just had a sense-taken Blackmore tube inserted. The nurse gathers supplies knowing that which of the following items must be kept at the bedside at all times. 1. An irrigation set. 2. A pair of scissors. 3. A Kelly clamps. 4. An abreudator. The correct answer is 2. A pair of scissors. 87. A client with appendicitis is scheduled for an appendectomy. The nurse reinforces preoperative teaching, describes to the client the location of the appendix and tells the client that the appendix is attached to the 1. Jejunum, 2. Ileum, 3. Cecum, 4. Rectum. The correct answer is 3. Cecum. 88. The nurse is caring for a client following Billroth 2 procedure. On review the post-operative orders, which of the following, if prescribed, would the nurse question and verify? 1. Irrigating the nasogastric tube. 2. Coughing and tea breathing exercise. 3. Leg exercise. 4. Yearly ambulation. The correct answer is 1. Irrigation the nasogastric tube. 89. The client is admitted to the hospital for treatment of acute hepatitis B. Which activity order would the nurse expect to be prescribed? 1. Bed rest. 2. Encourage ambulation. 3. Out of bed in chair. 4. No activity restriction. The correct answer is 1. Bed rest. 90. A nurse is caring for a client with diagnosed with pancreatitis. The nurse anticipates that the client would not experience an evaluation of which of the following enzyme? 1. Lipase. 2. Lactase. 3. Amylase. 4. Trypsin. The correct answer is 2. Lactase. 91. The nurse is providing discharge instruction to a client following gastrectomy. Which measures will the nurse instruct the client to follow assist in preventing dumping syndrome? 1. Eat high carbohydrate foods. 2. Limit the fluid taken with meals. 3. Ambulate following a meal. 4. Sit in high phallus position during meals. The correct answer is 2. Limit the fluid taken with meals. 92. The physician has determined that the client with hepatitis has contracted the infection from contaminated food. The nurse understands that this client is most likely experiencing what type of hepatitis? 1. Hepatitis A. 2. Hepatitis B. 3. Hepatitis C. 4. Hepatitis D. The correct answer is 1. Hepatitis A. 93. A nurse is caring for a group of clients on the surgical nursing unit. The nurse anticipates that the client who underwent which of the following procedure is most likely to have some long-term residual difficulty with absorption of nutrients. 1. Appendectomy. 2. Colectomy. 3. Ascending colostomy. 4. Small bowel resection. The correct answer is 4. Small bowel resection.